Good afternoon. Thanks for sacrificing your lunch and being here with us. I would be discussing the principles and practice of external digital photography in ophthalmology. When you go to see a Taj, I think there's not one amongst us who hasn't taken a photograph. So there are rules of taking photographs, as ophthalmological as well as non-ophthalmological. And I say that you have to know the rules in order to break them. But in clinical photography, it's better to stick to the rules. External photography is needed in the fields of orbital, oculoplastic and reconstructive surgery. Motility photographs are needed in strabismology, and clinical facial analysis is very important in aesthetic surgery. I will be discussing the backgrounds, the commonly prepared views, and standardization of photographs in clinical ophthalmology. The background of the patient should be non-cluttered. It should have a neutral color like gray or light blue. And the easiest way to do this is to carry a cloth along with your camera bag and hold it up behind the patient when you are in the OR or in the ward, or keep a panel similar colored in your OPD area where the patient usually sits. The most common view in ophthalmology is the frontal view, which is taken from the top of the head up to the jugular notch, and the head is straight. How do you know it is straight? You see an imaginary line from the upper edge of the tragus to the lower edge of the orbit, which is called the Frankfurt plane, and which should be straight. See, the Frankfurt line is not straight. If you cannot imagine the line, then you can activate the grid display on your camera if you have it. Some more photographs of where the Frankfurt line is not straight. The easiest way to see whether the face is straight is not to look at the eyes but the ears. If you can see both the ears equally, then the head is straight. The only instances where you should document abnormal head posture is when the patient has an abnormal head posture pre-operatively. This kid, because of the ptosis, chin elevation, and this kid, because of a blow-off fracture, he's got diplopia and trying to avoid it. The next view is the profile view. The patient is rotated 90 degrees and the contralateral brow is not seen. The other is oblique view. The patient is rotated 45 degrees. Offset the nose from the background by a strip of cheek. The compilation of these views is called a standard 5-view head series, which is important in aesthetic and oculoplastic surgery. Tip about taking a photograph of kids. Try to take the photograph as soon as the kid walks in your OPD, and you and your camera hold some interest to him or her. If you wait till your examination is over to take the photograph, all you will get is this. If you want to show the eyes, then just show the eyes. Nobody is interested in seeing the ears or the nose. Crop the photographs. The upper margin, keep it at the eyebrows, and the lower margin at the malar arches. Laterally, the side of the brows. For pre-operative photography, you have to titrate your lighting system and your flash. This is taken without the flash, but the camera was not on a tripod, so the picture is blurry. This is with the flash, but with the overlight light off, otherwise it will be overexposed. If you want to document the size of some tumor, or in this case an intraorbital foreign body, you can keep a scale against the lesion and document the size of it. These photographs can be taken with macro mode, which is designated by the flower icon in your camera, or you can zoom as close as possible to the object, or you can simply crop the photograph. The other situations in oculoplasty where you want to document is ptosis. Documentation of result of a test or post-operative situation is very, very important in aesthetic surgery. This is a Blepharoplasty series where the photographs are taken with straight gaze, eyes closed, up gaze, and eyes squinting. Lower lid Blepharoplasty should be taken with primary up gaze and down gaze. These views are called, no PGs, so no questions. Worm's whole view or bird's eye view, which are used to document proptosis or in ophthalmos. Motility pictures are taken in 9 gazes, and make sure the patients do not move their heads while moving their eyes, which they almost always do. Take the photographs and then crop them and compile them to get a picture like this. This is showing restriction in up case as well as down case. It's post-operative, showing improvement in the extraocular motility. So lower fracture. Flash. When should you use flash and when shouldn't you use flash? Remember, the use of flash washes out subtle findings, skin findings, if your dermatologist do not use flash. But there should be sufficient ambient lighting, otherwise your picture will come very dark and you have to have a steady hands or a tripod, and we'll talk about pre and post. Don't use flash when you are taking a reflective surface like radiographic images, but your camera should be steady, otherwise you'll get a blurry picture like this. You can use a tripod or any stable surface that you can find. Standardization. What is standardization? Look at this gentleman. This photo has been taken without and with flash. They look like two different people. If you use flash, the skin texture and color changes. So, if you're trying to show your post-operative results, then either your photograph should be taken without flash, both pre and post, or with flash, both pre and post. These are examples of non-standardized photographs. These are very famous author, lots of publications. But if we see this post-operative result of this technique, we are not sure whether the improvement in the appearance of the patient is due to the surgical skill of the surgeon or the beautician or the photographer. Because the pre-operative photographs are taken from a shorter distance. The face looks huge, it looks bigger. Makeup is put post-operatively, cannot compare. Cannot say definitely, but I think some of the photographs have been taken without flash pre-operatively and with flash post-operatively, and if you do that, almost always your patients will look better, fairer and lovelier. So in standardized, the version means you have to take your photographs without flash or with flash, both pre and post, and you cannot Photoshop your patients in clinical photography. At the most, what can you do in the editing stage? You can straighten your patient, you can crop them, you can minimally enhance the contrast and the brightness, and sometimes in some magazines charge exorbitantly for color photographs, you can turn them into monochrome, mask them or put on your watermark. That's about it. So in conclusion, in digital photography, read your camera manual, it will give you a lot of information. Most people I know, they buy huge cameras, but they don't read the manual. Always carry your camera. You never know where you come across an interesting patient. And take photographs of each and every patient. This is very, very important. Thank you for your kind attention.